Hi everybody, Kathleen Kent. I'm up here in the corner. I have been cleaning my house and going through a lot of boxes of papers, and in one of the boxes I found this little tiny pamphlet called Your Guide to Preparing for Pandemic Flu. I got it in 2006 after I watched an Oprah show on the bird flu, and I was moved to action when the doctor said, Oprah, it doesn't matter how much money you have. If there isn't a bed available, there isn't a bed available. No one's going to come to your house and take care of you. And you aren't going to be able to travel outside the country to go get medical care. And I watched her just kind of go, huh? She said, so what do I do? And he said, you get prepared at home for several weeks of shelter in place and no contact with the outside world. Physical contact, that is. Well, that got my attention. And somehow I came across this pamphlet from Santa Clara, and it's about the bird flu. Now notice, there's this one section here about the bird flu. Everything else in this pamphlet is about a pandemic flu. How appropriate that I would run across this week. And I want to share this information with you because it's kind of hard to find facts and know what to follow and what to trust. So here we go. Let's do a tour. What's a pandemic flu? A pandemic flu is a world outbreak of a new strain of a flu virus not known to occur in mankind. It generally comes from animals and is introduced into the human race. We don't have immunity to it. Therefore, it's easily spread from person to person because nobody has immunity. The coronavirus is spread by droplets from your nose or from your mouth. They land on a surface, and someone who it doesn't have the disease touches those droplets, and then they touch their eye, their nose, or their mouth, and that's how they transmit the disease to themselves. So if this becomes a pandemic, our lives are going to change significantly. Schools and daycares were temporarily closed, creating childcare issues. Public transportation and airports are going to have restricted boardings, are going to have even more restricted boardings, and are going to have cancellation of flights and schedules. The community emergency and medical services will be reduced. Businesses will limit their operations. A lot of people will start working from home, teleworking. They'll do teleconferencing instead of in-person conferences. There'll be a worldwide supply chain shortage, and that's already started with China. China has stopped exporting things, and we are starting to notice it in our country. Remember, China produces the ingredients to our critical medicines, and they also produce our disinfectants, and you're going to find out later why that is really important. So let's talk about the difference between a seasonal flu and a pandemic flu. Everybody knows about seasonal flu. Happens in the winter. We get an immunization in the fall. It's based on a cocktail of flu viruses that have been mixed together that will hopefully protect the majority of the population. Some people will still get sick with the flu and have to be hospitalized, but we have plenty of medical centers and hospitalization means to take care of them. Still, 36,000 people die per year on a seasonal flu, and that was back in 2006. I don't know if that number has changed. Let's talk about a pandemic flu. That's a whole nother animal. It doesn't happen often. It's not predictable. We had 3 declared pandemics in the 20th century. In 1918 to 1919, there was a Spanish flu pandemic. There was 20 to 50 million deaths worldwide. There were 500,000 deaths in the United States in 1957-58. There was the Asian flu pandemic. There was 1 to 2 million deaths worldwide, and there were 70,000 deaths in the United States. And in 1968 and 69, there was the Hong Kong flu pandemic. 1 million people died worldwide, and 34,000 died in the United States. If the coronavirus turns into a pandemic, our medical communities will be overwhelmed. They're going to be short on staff because some of their staff are going to get sick, and some of their staff are going to be quarantined because they were exposed to someone who had the disease, but they didn't have the proper protection. Medical supplies and medications may or may not be available. Remember, China shut down, produces a lot of our ingredients. Once a vaccine is developed for the coronavirus, it may not be effective. The first one may not be effective. They have to keep testing it, and then ultimately they will produce it and distribute it worldwide. Treatment drugs for the disease haven't been developed, of course, because we don't even know how to vaccinate against the disease. So when they are developed, they're going to take time to be tested and then produced and then distributed worldwide. This isn't just the United States fixation. This is a worldwide fixation. The number of deaths could skyrocket. It's going to have a big impact on nations, communities, businesses, and households. And it's going to have a big impact on the U.S. and world economy. Just this past week, ending February 28th, 2020, our stock market dropped over 3,500 points in 1 week based on the coronavirus uncertainty. So basic information you need during the pandemic flu is you need to know what is your public health department website address. You need to check that every day. What do they advise for your area, for you to do? If they tell you to stay home, isolate, or quarantine, do it. They may cancel public events in the interest of public health. If they tell you to isolate because you have the disease, what you do is you put a person in a room that has a door. They are kept in there until they're healthy. They are not allowed in or out unless they go to medical treatment, or maybe they have to go to the bathroom. But then you're going to have to always keep cleaning the bathroom every time you go in it if you have a shared bathroom. If you go into the room that they're in, they're wearing a mask and you put on a mask and gloves. You get in and get out, you take your gloves off and your mask off and you discard them in a wastebasket. You wash your hands, okay? If the isolated person must stay home for 2 weeks after a symptom begins and no visitors. So you need a calendar. Mark on the calendar when the first symptom occurred and what it was. If you're quarantined, that means you've been exposed to somebody who has the disease, and now public health has told you to go home and stay out of the public for at least 2 weeks to prove that you are not going to develop any symptoms. Seems like the symptoms show up in anywhere from up to 9 days. So, states and local governments have the right to enforce quarantine and isolation orders. So you need to follow this. This is for the public health. You've got to understand this is very, very important. Other things you can do is you stay healthy by eating right, exercising, getting lots of rest, and drinking plenty of fluids. And you stay informed by watching TV, reading newspapers. Well, you probably won't get those. Radio, internet. Just make sure it's science-based facts that you're reviewing. And then you want to observe common basic steps. Washing hands, cover your coughs, discard tissues, stay home. If you're sick, don't send your sick child to school, and avoid close contact with anybody that's sick. There's going to be a shortage of supplies and services. So the idea is to take action now so that you will have the supplies that you need at home. Every individual and family could be on your own for quite a while. So keep your emergency goods separated from your normal everyday goods. You want 2 weeks of food and water. You want 2 weeks of prescriptions and over-the-counter remedies. That would be ibuprofen, Tylenol, cough medicine, and a rehydration solution. And you want cleaning and sanitation supplies, all sorts of them. You want to get your cleaning and sanitation supplies, especially now, before there's a run on them, because that is our protection against this disease. Excuse me. Learn more, stay informed. I recommend going to the World Health Organization website. It has an accurate picture of what's going on today, any day, worldwide, and it also has good information on precautions and what they have discovered about the disease. We also have the cdc.government website. So the coronavirus is now called COVID-19. There have been other coronaviruses before, so they give it an official name, and now it's COVID-19. So it originated in Wuhan, China in December 2019. It is suspected that it came from a bat. The most common symptoms are fever, tiredness, and dry cough. Other symptoms are aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. Some people become infected, but they don't get sick. And most people recover from it with needing little or no special treatment. 1 in 6 could get serious ramifications from the disease and develop difficulty breathing. 2% of those who have contracted the disease have died. If you have a fever, cough, and respiratory difficulties, seek medical attention. So people can catch this from others who have the disease, and it's, again, as I told you earlier, it's from nose droplets or saliva spray. It lands on a surface, other people touch it, then they touch their own eyes, nose, or face, and that's how it's passed from person to person. So the way to stop this is for cleanliness. So get your supply of your disinfectant wipes and your hand wipes and your hand sanitizers. Go get that now. You can also get this disease from other people if you're standing too close to them and they cough, exhale, or sneeze on you, and you breathe in the droplets from their breath. So you want to stay 3 feet away from everybody, especially those that are sick. The risk of catching this disease from somebody who does not have symptoms is very low. But if somebody even has just a little mild cough, assume they are contagious. So the World Health Organization says regularly and thoroughly clean your hands. Maintain at least 3 feet difference between you and an infected person. At all times, as much as you can, avoid touching your eyes, your nose, and your mouth. If you feel inclined to do that, go wash your hands first and then do it. Follow good respiratory hygiene. That means putting your discarded tissue in a plastic bag in a wastebasket, and then you can throw the whole bag away without ever having to touch the droplets that are on the tissue. The droplets spread the virus. Stay home if you're sick. If you have a fever, a cough, and have trouble breathing, seek medical attention, but call first because they want to direct you to the correct medical facility you should go to. You don't want to be traipsing around with your symptoms all over the place. You call first and find out where they want you to go. Stay informed on the latest developments about this. World Health website is a really good website to keep up with it. And then keep track of your local public health department website. What do they say you should do in your area? Remember, a plan remains a thought until written down. I don't care if you use a workbook, you download a bunch of lists off the website, or you start from scratch with a blank sheet of paper. Do something. Take action to protect yourself and your family. This is really, really, really important. And we can't minimize the risk we are all at because we do not have immunity to this disease. Thank you. I hope you found this educational, inspirational, and that you will start taking action immediately. Your feedback is welcome. You can email me on my website at www.hazardstrategies.com. See you in the cosmos. Bye-bye.